I do want to, excuse me, Dr. Alameda, I do want to remind our viewers that our lines are open. If you have any questions for Dr. Alameda or for myself, please call us. Lines are open. Area code 312-738-1060. You were saying about the socks and it possibly being a tourniquet. Let's continue.
Well, what happens is if the patients buy socks that don't fit properly, they may fit properly early in the day. As you had mentioned, you get swelling towards the end of the day. So what happens if the socks don't fit properly or they fit tighter around just below the knee, that can cut off blood flow. As far as the inseam of the the sock and the stocking, that can create an area of irritation across the top of the foot, which in fact a lot of the patients have very thin skin. Again,
Right.
the thin skin comes from the lack of blood flow and also from the neuropathy or the lack of sensation. So again, those areas are predisposed to fissuring, and again, it's a very prone area to infection.
So in this case, because for those, I mean, most of us cannot afford to buy custom socks, obviously. So suggestion would be to turn your sock inside out, correct?
You can do that, yes. You can do that. Buy cotton socks, white cotton socks.
No nylon, right?
I don't recommend nylon because they don't have very good absorption for the if the foot has what we call hyperhidrosis, or you have a lot of sweating on the foot, that also predisposes you to fungal infections as well. A dark, moist area will predispose you to fungal infection, and then if you're diabetic, you're more predisposed to that infection.
Padded socks is something that's recommended as well.
Yeah, padded socks. They sell different types of protective socks and things of that sort for patients that are diabetic.
Now, I know I have seen, especially at our health fairs and when we have a community coming out for the free screenings on diabetes and the free meters, I have to admit, especially during the summertime, I see so many of them wearing sandals and open-toe shoes. Now, it's my understanding that a diabetic shouldn't wear open-toe shoes and or sandals. Why is that?
Well, again, protective. You're trying to protect that foot. It's prevention. If a little small piece of a pebble or something gets into that sandal and that patient's been walking on that pebble for 4 hours, that works as a foreign body, and that can create an opening in that foot, which again predisposes you to infection within that foot. So I know it's a difficult thing to do, but we do recommend, especially for those patients who have a lack of sensation, they definitely need to be a little bit more careful than other patients.
Now, for a diabetic especially, and I think it goes for anyone, buying new shoes, it's just always so hard breaking them in. But for a diabetic, would your recommendation be, and I've read a couple of things that, some say break them in a day, break them in every hour or hour a day. What's your recommendation, doctor?
My recommendation, it depends. If you have a patient that is a Medicare patient, let's say it's an older patient, an elderly patient, they shouldn't even be buying shoes at the store. Those patients, there's a Medicare program, a diabetic shoe program that they can participate in. Why is a diabetic shoe? You had asked the question earlier, what's the difference between a regular and a diabetic shoe? There's more room in the toe box. Well, the toe box is where obviously your toes sit. And when there's more room in there, there's less irritation on that foot, less pressure on those toes. And there's, if those patients do have some deformities like contractures of the toes, there's more room for them. If you have patients with deformities and the forefoot or in the toes, and those corns can rub on the top of that shoe, and I've seen it a number of times where they develop an ulceration there. Number two, there's a material on the inside of the shoe called plastizote, and that material has memory. What that means is that if you have a big metatarsal, a bone that's further down, a deformity, well, that material will actually accommodate that deformity, so that what you're doing is you're spreading the pressure, so it's not directly on that bone, and that'll keep you from breaking down and forming an ulceration. As far as the younger patients that are diabetic, again, they should wear shoes that fit well. They should have the person at the shoe store actually fit them for those shoes.
And no
They-
pointed shoes, right? I mean, 'cause
well,
pointed shoes.
the young
pretty
women
cringe.
are not going to be very happy with me.
Right.
But I think that women can wear nice, beautiful high heel shoes when they go out to dinner, when they go out to church, when they dress up. But for your day-to-day activity, dress flats with a nice wide toe box is probably the best recommendation I can make for a young patient that's diabetic.
Boy, our time, guys, it goes by so fast. So we only have about another minute or so, and we can keep talking about diabetes and foot care. But to leave the viewers today, what is it that you would leave them? What information would you leave them with that they should do to take care of themselves better as a diabetic?
Prevention. Prevention is that word is worth its weight in gold. Prevention. I can't impress upon anyone who's listening to this program and watching this program. You must focus on prevention. If you prevent these problems, you can live a long life, a very productive life, and not go through these tragic situations. I had a patient I just saw actually I was having lunch, and I hadn't seen her for a while, and she'd been through multiple surgical procedures, even total knee replacement because her feet were in such bad shape. And right now she's a 51-year-old totally disabled diabetic.
Wow.
And and when I say prevention, you must take care of your blood sugars. You must control your blood sugars. You must check your blood sugars daily and have your physician draw the labs that will substantiate that you are under control. And if you're not, then your primary care physician can adjust your regimen.
Well, for those of you hearing today and listening to Dr. Alameda, for more information just about what we're talking about today, please feel free to call Dr. Alameda, and you can reach him at his office location, 7107 West Belmont here in Chicago, but he has several other locations as well. The number you see on your screen is a 773-237-1122 number, which reaches all his locations actually, and you can schedule, or like I said, if you need just to talk to Dr. Alameda because you have a question, please feel free to give him a call. I want to tell our viewers, as always, it's always a pleasure for us to come out and provide information to you and for you on those disease states that affect us as a whole, as communities, not just from diabetes or cardiovascular disease, but all those things. For Hispanocare, as you know, as I've mentioned before, that we are a program of Advocate Illinois Masonic Hospital and affiliated with Gottlieb Memorial Hospital. For information on Hispanocare and our upcoming programs for 2009, please give us a call at area code 773-296-7157. Again, we have our calendar for 2009 that we're working on right now with about 40 programs that are all related to healthcare and prevention. So we welcome you to give us a call to let us know, for us to let you know actually what's going on in 2009 with the community health fairs, with the lectures, including Dr. Alameda, who comes out to many of our events. Thank you. We couldn't do the things we do without your assistance, and we truly, truly appreciate your support
You guys
in
do a
providing
great
this
job.
free care. But on behalf of all of us here at Hispanocare, thank you on behalf of Advocate Illinois Masonic Hospital, Gottlieb Memorial Hospital, and come out to all our screenings because we have a real heavy-duty schedule coming up in 2009. Until then, you're watching CAN TV 21. We'll see you next month. Stay tuned for next program. Thank you, Doctor, for coming out.
Thank you, Lucy, for having me.
Do so.
Thank you.